Okay, so tongue coating in the treatment of small intestinal bacterial overgrowth. A lot of people with chronic SIBO have this thick white tongue coating that's kind of like fuzzy on top. And it's not thrush, it's not candida. What is it? Hi, I'm Dr. Joyce Knieff. I'm a naturopathic doctor, and I see a lot of complex chronic health conditions like small intestinal bacterial overgrowth. And while in conventional medicine, there's not any direct established link between tongue coating and pathological processes like small intestinal bacterial overgrowth, in Chinese medicine, this does make a lot of sense. And in Chinese medicine, the surface of the tongue is used a lot in diagnosis. We look at the tongue to get sort of an assessment of somebody's constitution. And a thick white tongue coating on the surface of the tongue in Chinese medicine is related to a concept called dampness. Without getting too complicated in my explanation here, dampness basically most likely comes from digestive weakness. So there's something going on in the digestion in which your body is not processing the food that you eat. And because it's not processing the food that you eat, it accumulates this substance called dampness in your body. And the symptoms that result from dampness are manyfold. A lot of it has to do with like heaviness, either of your body or of your mind. So like mental fog, feeling like you're wrapped up in cotton, or feeling sudden fatigue after eating are all manifestations of dampness. What's fun is that some of these are also things that result from like inflammatory reactions from SIBO. I know that bloating is the hallmark symptom of SIBO, and bloating from a Chinese standpoint can be digestive weakness, or it can be something called qi stagnation. But some of the other inflammatory symptoms that come from SIBO can be manifestations of dampness. And if we're looking at this from like a higher meta perspective here, it does make sense because the tongue coating being white and the dampness being related to digestive weakness, and small intestinal bacterial overgrowth essentially being like a pathology that is going to impact the digestion and processing of your food in the small intestine. It kind of like interrelates with each other. So if you still have a thick white coat after the treatment of SIBO, especially after like eradicating the bacterial component and resolving the motility of your gut, so now your small intestine is moving correctly and you don't have the bacterial overgrowth in there, if you do still have the white tongue coating, I think that would be more of an indication to work a little bit more on the digestive capacity, maybe looking into like pancreatic enzymes or the gut lining integrity, seeing if there's still maybe some increased intestinal permeability that is going on, or if there's maybe like a lack of stomach acid or a lack of pancreatic sufficiency with the enzyme production. Those would be the things that I would look into to see if we can basically help the digestive strength in resolving dampness. And then after we are able to like resolve this issue of like digestive weakness, many times the dampness does resolve, so that thick tongue coating eventually becomes more of a thin white coat instead. And that thin white coat is the normal picture that we like to see in Chinese medicine. Hope that helped.